Multnomah County is going through its budget process now. County Chair Jessica Vega Pederson's $4 billion budget proposal includes big investments in community safety and health, but also reduced funding for a number of homeless services amid a $77 million shortfall. Among those services that could be eliminated, the Old Town Inreach Program, or OTIP. Started in 2022 by Kerman of Blanchet House, OTIP pairs people experiencing homelessness with so-called peer support specialists who have been through it themselves, connecting folks to services they need. OTIP is now a partnership with 6 Old Town social service providers operated by the Mental Health and Addiction Association of Oregon. It currently receives about $900,000 from Multnomah County. And here to talk about the Old Town Inreach Program, Kerman of Blanchet House and Katie O'Brien of Rose Haven, another of the OTIP partners. So thank you for being here on Eye on Northwest Politics.
Thank you, Ken.
Well, how many people are dedicated to the Old Town Inreach Program, and just basically how does it work?
Yeah, good question to start with. So there are 4 peer teams of 2 peer support specialists, and they provide services on a rotating basis at 6 agencies. And what's really remarkable about this program is that the peer teams are at our locations when we need them most. So for instance, we have a peer team that is with us during our breakfast service from 6:30 to 7:30 a.m., helping us resolve crisis and provide resources and referrals to people seeking breakfast with us. And then when they're done with our breakfast service, they go up the street to Rosehaven and support the services there. And this is happening with different teams at different locations. And so it is a fiscally responsible program because we're only using the resources when we really need them most. And we're sharing labor and sharing expertise. And because we share a lot of the same clients, it's created a continuity of care and a holistic approach that has been missing.
How do you gauge accountability for this? How do you know that this actually works, this peer-to-peer counseling?
We wish more people could see it work because it's sort of magical in the way that it diffuses a lot of things on site for us. So people will, sometimes the peers will come from Blanchet House, they'll send us a text ahead of time, so-and-so struggling today. We're going to meet her there and we're going to work through her housing and some mental health work with her and things like that. And so they actually keep stats on all those conversations that they have, how many de-escalations they've had, how many housing referrals they've had. The numbers are good and they probably don't reflect how truly impactful they are. You know, they had 2,000 housing and shelter referrals last year alone. And I think on an annual basis, they'll have about 600 de-escalations that they're tracking. And those are things that haven't become problems. They've helped somebody in need kind of in that crisis moment.
Chair Jessica Vega Pederson from Multnomah County says she's looking to fund what she calls direct services. So her proposed budget document says, due to budget constraints, elimination of the Old Town Inreach program was unavoidable. So can OTIP services be absorbed or replicated by other programs?
Well, no, it's very unique. And because they are on site when we are having services, they are able to react in real time to people's real needs. I kind of liken it sometimes to having a fire extinguisher in your kitchen. Hopefully, if you have a small fire in your kitchen, you can use the fire extinguisher to keep a small fire from becoming big. If you don't, and you have to wait for emergency response, it might get out of control. What OTIP does for us is it de-escalates situations before they become unmanageable or perhaps requiring a first responder. So it's an important program for alleviating the burden that's already been placed on police and other response.
Well, you know, the budget constraints that the county is under, $900,000 doesn't seem like a lot of money when you look at the total budget. But can you understand the challenges that the county has in order to try to save programs like this?
I appreciate the challenge for sure. And I think this speaks to just not understanding impact well enough. It is a huge bang for your buck, and it's kind of a silent force. And so that's kind of why we're here, to sort of continue to advocate for the power of this and the way that it not just serves our guests really well, but it helps our agencies and our staffs and the businesses across the street, and neighbors and full communities are feeling the impact of this.
Well, Multnomah County has to come up with their final budget on June 12th, I believe it is. So we're coming down to the wire in terms of the decisions that they have to make. So what can you do in terms of advocacy between now and then to maybe keep OTIP operating?
Well, doing things like this, we're just trying to educate everybody, including our county partners, in what this program does. And yes, there are a lot of cuts to programs, and many of them, maybe all of them, are going to be really devastating. There's a lot of pain that we're going to experience in the homeless services provider community, which in some respects makes OTIP all the more important, because the peers are expert at identifying and locating and connecting resources. And sometimes services, they don't always occur at the same place at the same time, and it requires somebody to help navigate that. And I think we're going to see a lot of services disappear that people are used to. And the OTIP peers can be an important resource for helping people in need navigate what's going to be, unfortunately, a very changed service landscape.
You both work with homelessness on the ground, both in Old Town. What have you seen, say, over the past 6 months to a year? Has there been any improvement in terms of what we see on the streets?
It's been challenging. I think the mental health of folks is deteriorating pretty significantly. I would say that last year we were getting some traction on finding more shelter resources for people, and so it's worrisome to think about what that's going to look like if those resources go away. Yeah, people are struggling, and I think the other component to this is people's challenges are more complex, than they were even 5 years ago. And so you have peers who have this experience in the mental health space, in the resource navigation space. They're kind of experts at connecting and deeply understanding, and their ability to relate and be trusted by the people that they're serving it's just work that we can't do on our own.
Well, if the funding is eliminated, will you still try to replicate some aspects of this program on your own? Kind of try to piece it together to make it work?
Well, in some respects, we have to. I mean, it is actually unimaginable for us and our staff and our volunteers to serve as we do without this support. It has become that essential to us. And so part of this right now is we're hoping, maybe we attract the attention of benefactors. One thing that's important to note about the agencies who are involved in OTIP is that we don't really receive public funding. Maybe zero, maybe very little. So we have been privately funding services in this crisis to the tune of millions and millions of dollars, since COVID launched. This is going to add to that burden, but we have to do this.
Katie O'Brien, Scott Kerman, thank you very much for being on Eye on Northwest Politics, and good luck.
Thank you.
Thank you.
We'll be right back.